I'm Thomas Baldrick at ASH 2014. Delighted to have with us Dr. Catherine Broome from the Georgetown University Hospital. Thanks for coming by.
Hi, thank you.
So you're working with Eculizumab. Let's talk about this study you're doing and why you undertook it.
Atypical Hemolytic Uremic Syndrome is a very recently recognized disorder, particularly in this group of very ill patients who have received solid organ transplantation.
What were the limitations with this patient population?
They are incredibly complicated, many different abnormalities going on all at the same time. And the most difficult aspect of the study and the patient population is really putting together so many pieces of laboratory data and trying to synthesize an actual diagnosis.
How did you do it?
Well, we took a retrospective analysis of our patient population over the last 2 years, applied a very stringent class of laboratory criteria in order to see in a retrospective fashion if this would allow us to identify these patients with post-transplant atypical hemolytic uremic syndrome. And we were very successful in the laboratory parameters that we chose.
And what have you found that you've been able to share?
We have found that patients who are undergoing solid organ transplantation have about an 18% risk of developing post-transplant atypical hemolytic uremic syndrome. And if we apply the 4 criteria that we identified in our particular study, we can identify all of those patients moving forward so that we can offer them a clinical intervention, which is Eculizumab, which is a very successful therapy against this very devastating complication.
And how will you move forward in this research?
I think that we would like to undertake a prospective analysis where once these patients are identified, we randomize them to either receive Eculizumab therapy or best supportive care so that we can continue to demonstrate the potential benefits of this particular form of therapeutic intervention.
What's your key takeaway at this point in time?
Our key takeaway is to have an open mind and to really look at these patients with a critical eye, recognizing that this very difficult clinical syndrome, atypical hemolytic uremic syndrome, can present in these very complicated patients.
Very good. Dr. Broome, thanks for joining us.
Thank you very much for having me.
Come back and keep us posted, would you?
Absolutely.
Okay.
Thank you.